Now we're going to see juvenile rheumatoid arthritis, also called idiopathic juvenile arthritis. Here we have like 6 conditions. We're going to review 5 of them. Actually, it is more like we're going to review 3 of them because the others 2 are like we know them. So this is in patients less than 16 years of age associated with morning stiffness for more than 6 months. A little bit more common in girls than boys. The treatment would be NSAIDs and exercise for stretching. If the NSAIDs fail, then we would give corticosteroids, and if this fails, anti-tumor necrosis factor drugs, for example, like etanercept. Alright, so we have the enthesitis related juvenile psoriatic arthritis, pouchy immune, that is the oligoarticular, polyarticular, and systemic onset. So the enthesitis related enthesitis is the inflammation of the tendon at the insertion of the bone, and this is seen on the seronegative spondyloarthropathies. So this will be just that on a young patient less than 16 years of age. Then we have the juvenile psoriatic arthritis, that is like psoriatic arthritis, that is one of the seronegative spondyloarthropathies that include in that subtype dactylitis, enthesitis, and the finger in cup or pencil cup appearance. So it's that same thing but in a patient less than 16 years of age. Now we're going to enter to the interesting ones. Pouchy immune is up to 4 joints that are involved. The patient usually does not have the systemic symptoms. It is positive for antineutrophilic antibodies, but negative for the rheumatoid factor. And classically seen in girls more than boys. The interesting feature here is that it's associated with uveitis. So we need to do slit lamp examination for the diagnosis, and every 3 months, unless more than 7 years. So we can do it every 6 months. Continuing with the polyarticular subtype, this is involvement of at least 5 joints. Could be the hand, the neck, weight-bearing joints, etc. Here we could have the rheumatoid factor or the antineutrophilic antibody. They are both associated with a more severe form of the disease. The ANA positive would be associated with a more severe form than if it were negative. But the rheumatoid factor, if it is positive, this indicates severe disease most of the time, more severe than the ANA. You could say that's milder disease, but that's more severe than if it were negative. Anyway. And the patient that has the rheumatoid factor being positive could have rheumatoid nodules. And lastly, the systemic onset. Here the patient has systemic symptoms. The inflammation of the joints could occur months or years after these systemic symptoms appear. And here we also have a salmon color rash. We also have leukocytosis, lymphadenopathy, hepatosplenomegaly, and high fever more than 39 degrees Celsius or 102 degrees Fahrenheit. But also the patient is fluctuating and has those spikes on the temperature. The mnemonic for the systemic onset is still. Remember that this is also called still disease, and the mnemonic would be in still. You have also the mnemonic S of you can see the systemic symptoms, T, the temperature elevation, I, ill appearing patient, leukocytosis, and lymphadenopathy. So that is for this video.